Hi, my name is Dr. John Shim, and today I'm going to talk about a topic that is a very difficult one. I'm going to talk about the situation where the surgeon recommends against your spinal surgery. Some of you will come to see me after you've had that recommendation, and usually you're quite distraught. But you have to think why a surgeon would make a recommendation against an operation. Most of the time it's because the studies, the x-rays, the CAT scans, and the MRIs do not match your physical examination findings. Surgery cannot benefit you. To give an extreme example, an x-ray of a broken foot does not mean surgery to your hand will fix your foot pain. When in pain, this can be a very disappointing discussion, I know. The second category why a surgeon would recommend against surgery is because the risks are simply too high. Unfortunately, we have lots of people who also have lots of medical problems. For an example, a bad heart, bad lungs, diabetes, or bad kidneys. The risks are simply too high. Surgeons can do the operation and can hopefully finish the operation, but there are concerns that you'll have complications such as a heart attack or bad infections or even worsening complaints after the operation. Usually a surgeon would recommend against surgery in that scenario. The third category why a surgeon would recommend against surgery is because the expectations are just too high. As surgeons, we know we can restore people back to a certain level of function. If you're 65 years old, we can return you back to the average 65-year-old person activity, but we cannot return you back to the age 21. If you're not realistic about that, you're going to have a very disappointing outcome. If you're not realistic about what the surgery can accomplish for you, most surgeons would not recommend surgery for you. If a surgeon recommends against surgery, please consider the three scenarios discussed. Do my studies match my physical exam findings? Are the risks reasonable considering my other conditions? Am I being realistic about the surgery? This is Dr. Shim talking about a very difficult topic. Thank you for listening.